everyone. Today is supposed to be the orthodontic day, and the whole week of from 5th October till the next week, the whole week is considered as an orthodontist day, and this presentation is just as a orientation or a educational program for what are the things that we can do with orthodontics. I am Dr. Mithun, Naik. I am an assistant professor in A.J.INSTITUTE of Dental Sciences as well as a consultant orthodontist in Thaj Dental Clinic, Talsheri. Everything in nature is about balance, isn't it? Balance about good and bad, evil and goodness. But all of this has to be in a nice balance so that you can get a normal physiologic being. We need to have a physical, mental and emotional and spiritual balance among ourselves. Okay? But whenever there is malocclusion, now what is malocclusion? Malocclusion is something related to the jaws or to the teeth. If there is an imbalance somewhere in the malocclusion, which can create your poor aesthetics, or also can lead to have functional needs like occlusion gets hampered, which will finally lead to us inferior self-esteem of the individual. Aesthetic has always been like the driving force for us, our patients. Okay, so we as orthodontists, we always strive to get aesthetics, health and function, stability has to be maintained for all our patients. If you can see, what do you think this is? This is nothing but a plant. If you want to make it grow at certain pace, you need to stabilize it using any rod or anything so that we can pull or monitor it across so that it grows into that normal stature. So what is a myofunctional appliance? These are appliances which will help a jaw to grow in a particular direction so that we can modulate the patient into a nice looking or a pretty looking face. Okay, this is the patient which we have treated. You can see from the teeth which are very forwardly placed to this one which is nicely placed here. You can see the jaw being in harmony. You can see the lips being in quite harmony here. You can see the patient had undergone this type of treatment. There are braces which are placed to the post-treatment results which you can see. You can see that the teeth were very much forward. We have got it back along with removal of few teeth. Now there are certain smiles like this patient. This patient always wanted his smile to be more prettier. As you can see here, you can see that one of the teeth is buccally placed or it was placed forward. Yeah, you can see that here to what it is now at this point of time after the treatment. So how did we reach there? It was from this position to this position out here. So did we remove any tooth? No. There are certain malocclusion where you can just treat the teeth in such a way that it can come into its own position. Certain cases where the gums are very much exposed. Can you treat these cases? Yes. You can see that. You can see that these gums are very much exposed. You can get the ortho treatment done so that the gum exposure can be lot reduced. You can see that even in the intraoral photos that from forwardly placed to backwardly placed out here, we have removed few teeth here so that we can get nice results in this case. Another type of case where you can see that the whole jaw is shifted towards one side. You can look at the way how the smile is. You can literally see how the jaw is oriented. From there, you can see how his teeth are forwardly placed, lot of spacing everywhere. You can see to this smile out here, how there is a nice curve arc, to how the things have changed side. This is just the comparison for you to compare between the forwardly placed teeth here to how it is at the end of the treatment. Another case, especially with the smile again, You can see that we saw a similar kind of case which had a forwardly placed teeth as well as a buccally placed canine. You can see what we have done. We have removed one tooth here so that this teeth can come into this position out here. Okay, there's another type of malocclusion which is called as a crossbite. You can see one of the teeth, you can literally see that the smile arc is not correct. You can see one of the teeth is completely gone in to how her smile is at this point of time. So how did we do that? We have just tried to get that teeth out into the exposure here. You can see from there to out here. We have just got that teeth which was there present. We have just got it outside. Another type of case where a crossbite is there in the front teeth. So most of the time what happens, this kid which is still growing, if we have the whole upper jaw which is restricted by the lower jaw, it will not allow the upper jaw to grow further. So what this can lead to is something called as a class 3. Okay, what the appliance what we have used is something called as a Frankel. You can see that this is how the appliance sits in the mouth, and you can see the results of the appliance, and this is how the teeth actually looks like. Just to compare this in the photograph, you can see this in the patient's face. You can see the result from this position to this position. Another case of face mask therapy, the same type of case. You can see how the upper jaw is placed behind. Sorry for that. How the upper jaw is placed behind to how the upper jaw is at the end of the treatment. What we're basically trying to look at is for the upper lip and the lower lip. All of them need to be in harmony so that we get a good facial proportions. We have gone ahead with a face mask therapy there, then with the fixed braces treatment to that position. Another case which of a similar type of malocclusion where the upper jaw is behind and the lower jaw is ahead. You can see that the teeth are very much arbitrarily placed. Every tooth is haphazardly placed. There is an anterior crossbite as well. So what we went ahead is to expand, that is we use a screw so that it expands the arch. Along with that, we went ahead to give something called as a face mark. So from there, this is the end result of the patient from there to there. So you can see the changes from a concave profile, what we call as the concave, where the maxilla or the upper jaw is behind, to a normal facial proportion. Now in certain cases where the growth has already finished, we can't just believe on this orthopedic appliance, whatever I was told previously. Some cases where jaw is at fault after the growth phase is completed, we might have to treat them in another way, called as a surgical mode of treatment. So in this case, you can see that the lower jaw is very much ahead. So what we did, we went ahead with the surgeries for that, as well as the malar portion, that is this portion here. You can see that the fullness was not there. So they have gone ahead and put some implants there in that section, so that you get a full nice facial expression. So this is at the end of the treatment. Just to compare it across between the photographs, you can see the chin prominence being increased with the time, as well as the jaw prominence being reduced.
Doctor.
And this is the sequence of treatment, how it has gone. So at the end of this phase, we wanted to reboot the whole appliance, and this is how we have finished up the case. Okay. So just for a comparison, from that smile there to this smile here. So you can see that at the end of the day, what do we look at? We look at how your lower lip and upper lip are in relation to that of your upper and lower teeth. As you can see here, the lower teeth is going to be lying somewhere in the upper teeth, restricting it from coming front. So this you can see we have done a superimposition of the same so that we can understand what type of tooth movement we have done. So to wind it up, how do we go ahead with the treatment for the orthodontic tooth movement? It is not just about the braces which works. It is, we have to literally get the patient somewhere at around 7 to 8 years of age so that we can see them young and treat them at a younger age, so that it doesn't lead into a more complex or a complicated case where we have to do a surgery and get the things back. Do visit an orthodontist at around 7 to 8 years of age for an early treatment protocol. Thank you.